41-year-old Christine Rivera is in pretty good shape. So when the Miramar mother of two started having chest pains a few weeks ago, she didn't really think much of it.
Sat down in the chair, started to read some email, and I felt a squeeze in the center of my chest.
The ER nurse called her own mom to come pick up her girl so she could drive herself to the hospital.
By the time I got off the phone, the squeezing became more intense, and my arm went completely numb. So that's when I knew I better call rescue.
Turns out Rivera was having a heart attack.
Fortunately for her, she's an emergency room nurse. She does recognize the symptoms and did do the appropriate thing at the time.
But emergency room physician Randy Katz from Memorial Regional Hospital says most people don't recognize the symptoms.
Things like dizziness, nausea. Women tend to have very atypical symptoms, arm pain, jaw pain, without chest pain. Diabetics as well tend to have atypical symptoms.
Katz says you must act fast when you have these types of symptoms because if you are in fact having a heart attack, you could cause permanent damage if you wait too long.
So the heart is a muscle just like any other muscle in the body. Within a few minutes of not having blood flow to that part of the heart, there can be death of cells. Within an hour or two, you can have permanent dysfunction of the heart. They can have congestive heart failure, weakening heart muscle, and it can permanently affect their life.
Rivera, the nurse who takes care of everyone else, now plans to change her lifestyle and pay more attention to her own health.
I got 2 small children. Totally makes you rethink everything.